Welcome back to Plant-Based Kidney Health. Michele Crosmer and Dr. Hashmi here. And this episode is for you if you have kidney disease or are on dialysis and you suffer from a poor appetite. Dr. Hashmi, why do people with kidney disease and even more often when they're on dialysis sometimes suffer from lack of appetite?
Yeah, unfortunately, what ends up happening with kidney disease, advanced kidney disease, dialysis, we have so much accumulation of toxins in our body. Specifically, it starts from the gut microbiome that starts to completely get altered. And as a result of it, you have all of these toxins that get produced. Now, we know some of those as the uremic toxins that are out there, and we'll talk about those in a second. But even more so than that, what the new data shows is that in addition to all of that, there's actually dysregulation in appetite hormones. So, for example, we know that ghrelin becomes altered. So, ghrelin is your hunger hormone. You need it to secrete. It doesn't get secreted the same way. And as a result, your appetite is going down. In the opposite spectrum, in obese patients, we know there's too much ghrelin, and we are trying to always block ghrelin release. But here, we have too little. Same thing with other things like cholecystokinin and other hormones that are available. So the bottom line here is there's this very, very complex pathway that the more advanced chronic kidney disease, the more dysregulation you have of your appetite centers. So then, Michele, when it comes to this, we know that the appetite is going to go down. Outside of medications, what can people do to try to increase their appetite from a non-medical perspective?
Yeah, so there's several tips that I'll go through, but I think the first thing, and hopefully what your, especially if you're on dialysis and have a renal dietitian in the unit with you, but I think it's important to kind of try to get to the root cause of what it is. As Dr. Hashmi mentioned, the buildup of uremic toxins. Well, are you getting then adequate treatment on dialysis? Are you getting, or do you have good clearance in your blood and some of those toxins, are they being removed adequately? Do you have taste alterations? Is that something going on? Do you have poor oral hygiene? I'd say that's one of the tips to try to help improve your appetite is make sure that you're flossing and brushing your teeth, twice a day, and that you are going to the dentist and getting regular teeth cleanings and checkups because things like that can even just affect your taste and your ability to eat and your appetite. Some other things, of course, if you eat smaller meals but more frequently, so you can try to, sometimes just sitting down and eating a big heavy meal doesn't sit well with people. A big thing I would say too is you can try to make your meal look more appealing. That can be different for everyone, maybe the color of the food on your plate or trying a new recipe. But, I've cooked before where I look at my plate and I'm like, oh, I made tofu, cauliflower, and white quinoa. Like everything on the plate is white, and that doesn't look as nice and appetizing to eat as if I had tofu, asparagus, and I don't know, wild rice or red quinoa. So there's things like that. You can just change the appearance of your plate. Of course, you can add flavor to your food. So spices and herbs and vinegar and lemon and lime and hot sauce. Those are all things that can help just your meal taste better, maybe smell better so that it can help increase the appetite. Other things that are making, try to eat, if it's hot months, try to have more cold foods. And if it's cold months, having hot foods like soups and, anything you would normally put in a salad in the winter, you can really throw into a soup and then have it as a warm dish. So sometimes those can help. Getting outside, getting fresh air. Sometimes it's related to nausea, that poor appetite. So outside, fresh air, good sense in general, and then being active daily. And this is both having some aerobic and some resistance activity, but that could be as simple as getting out for a walk or having some light weights or body weight. But those are things that can help to improve your appetite that, aren't medication. They're just kind of diet and lifestyle things. And then I would say just try to be patient with it because it's one of those things where you're like, oh, well, I went outside and I exercised and I'm not hungry. Or sometimes these are things that just, it's a process and it takes time and being consistent with trying some of these things over time. You can start to see that your appetite improves. So Dr. Hashmi, then from a medication or supplement standpoint, what are things that can be used in people to help improve their appetite?
Yeah, and unfortunately, not a whole lot. Now, ever since I did my training, which is now a long time ago, we're still using Megace or Magestrol acetate, which is basically a progesterone analog. And this is used in cancer treatment in patients who have cachexia going on while they're going through cancer. So the thing over here with Megace or Magestrol is that it can increase weight. You will see that people's albumins might increase. But here's the biggest problem. The weight that they gain is mainly fat. It is not muscle. And so essentially what you're doing is you're creating more insulin resistance. You're getting the wrong type of weight that's coming on. So yes, it helps temporarily, but it's actually leading to more issues on the long run. So not just that, the side effects are quite substantial. For example, there's fluid gain that happens when you put people on Magestrol. There's swelling as a result of it. So you're not meeting your dry weight. You can develop shortness of breath. There's nausea. But more importantly, there's a risk of blood clots, and that's a very real side effect. In addition to that, it can also cause adrenal suppression if you're using it at high doses or longer term doses. And why should you care? Because if you're going under anesthesia, you're getting your fistula repaired or something else is happening, and you have adrenal crisis. And remember, your adrenal glands do two things. One is they produce their own steroids. The other is they produce mineralocorticoids. So mineralocorticoids are regulating salt in your body and potassium excrete in your body. When you get an insufficiency, whether you're an advanced CKD or ESRD, if you get an insufficiency of both and you have adrenal crisis, that's a really big deal. So unfortunately, it's not the best medicine, but it's one of the only medicines. So we use it, we watch patients very, very carefully. Now, on the horizon, there's a bunch of new stuff. So people are trying IV or injectable ghrelin, because what does ghrelin do? It stimulates the appetite. So that's being tested right now. There's an oral version of ghrelin, which is being tested in studies right now. It's actually available. It has some really interesting data in that it can potentially stimulate the appetite. Most of our data on appetite stimulants comes from oncology, from the cancer treatment specialist. There's not a whole lot of research that's directly done in our dialysis patients. In some patients, we use carnitine. As you know, carnitine deficiency is interesting because it can cause all sorts of things. People who have refractory low blood pressure during dialysis, we'll give them carnitine. Sometimes there's refractory anemias, we'll give them carnitine treatment. There's all sorts of things, but carnitine deficiency can also lead to cachexia. And so that's something where we can use carnitine to help. And then other stuff that's more over the counter that makes a minor difference is branching amino acids, leucine, isoleucine, valine. So BCAAs actually have been studied, and a couple of things they can do. They can improve your overall KT over V, which is a measurement of clearance, and they can improve your albumin in ESRD patients. So branching amino acids are interesting in that they may not be directly improving your appetite, but they may help to improve your risk of mortality by improving your albumin, making the clearance easier. And the question is if you were taking Magestrol, should you also take branching amino acids?
Very interesting. Well, there you guys have it. Some tips for how to help improve your appetite if you have kidney disease or if you're on dialysis and are struggling to get more food in. See you guys next time.
Thanks, guys.